welcome to another episode of the Matriarchy Times podcast, Matriarchal Voices. As always, we have a special guest today, an extra special guest, because it's Miss Kirti Patel, who is a board certified OBGYN, and she has over 20 years of experience in this. And recently, she has started her own podcast called The Gynecologist, and she was kind enough to give us some of her time to join us here on our podcast too. So, if you have tuned in or listened to the Gainaki, you know that she talks mostly about topics related to women's health and women's mental health and feminism also. And she also talks about how health is a big issue when we are trying to balance equality and how these issues kind of are essential and have broader implications to society. So I'd like to introduce Ms. Patel now. Hi, Ms. Patel, and how are you? And can you tell us a bit about yourself?
Thank you. Thank you for inviting me. Thank you for drawing attention to my podcast. I really appreciate it. Well, I am from the US. My parents are from India. They immigrated in the 70s, but I grew up in the US, so I'm American. And I'm a doctor there. I grew up in New Jersey. Um, yes, like you said, I've been practicing over 20 years in OBGYN. Now I mainly practice gynecology part-time. And my fun hobby or mission, I guess, has become this podcast and to draw attention to women's issues, um, and in particular women's health, but other issues as well that affect women.
And so, how has it been? Like, how has your journey, like, what ways have you noticed that the patriarchal systems have failed women's health, and how does this reflect within our society as a large issue? How is women's health like important? What do you think?
Yes. Well, women's health is so fundamental, right? From my experience of taking care of women individually, I just see that so much. A woman cannot do anything in life without her health, right? You cannot pursue an education. You cannot work on your career. You cannot have a family. You cannot advance to a leadership position. You cannot um, really succeed in life as an individual unless you fundamentally take care of yourself and your health, right? So I see that on an individual level, but I see that societally as well, right? Women neglecting women's health keeps us weak and away from, you know, success and in society, the broader sphere, and keeps us away from leadership positions and really representing um, women's needs equally. So that's why I think it's so important. It's like the bedrock. I think it should be a bedrock of feminism to focus on women's health.
Yeah. Oh, yeah. I also understand what you mean. Like, we have so many issues that men don't understand. Like, it's hard for us to explain, like, for example, like menstruation. Like, no matter how much you try to
Yes.
explain it, it's very hard for people to understand. And how do you think the patriarchy has, like, what of the patriarchy do you think has been fundamentally kind of downgrading the importance of allowing women to live a healthier life? Yeah, where do you see the patriarchy coming into this? Like we know, like patriarchal
Oh.
structures kind of affect things in different ways. How does it affect health?
Yes, absolutely. I mean, unfortunately, if you really think about it, right? The way I think of patriarchy is a hierarchical system, right? It has a few winners at the top, and everyone else is pretty much losers. It's, a small number of powerful people, usually white, usually male, and everyone else is striated below, right? And the way I see this is, when focusing on away from women's health, or even harming women's health, is kind of part of the design, right? It's another way of keeping women poor, disabled, struggling, in life, and that weakness of keeps us away from powerful positions, power, money, access, freedoms that other people enjoy, other higher up in that hierarchy enjoy. And of course, there's also an element of racism as well, so looking from an intersectional lens, also not focusing on the health and well-being of people of color also keeps these groups down, right? So the women as a group are lower down in the patriarchy, and then women of color are even further lower down, so I think have I answered your question with that? Perhaps I could expand. I could keep going. I mean, there's so much shame and stigma around women's health as well. Like you mentioned, menstruation, and preventing attaching shame to women's bodies, normal function, sexuality, stages of life, aging. That's all part of the design of the patriarchy, right? And we're ashamed to speak about these things. So we don't know enough. We're not educated enough. We don't speak to each other. So it prevents learning. It prevents improving our health. And that's all part of the design. I mean, people don't think about it too much, and they just think, well, I think the patriarchy would like us to believe, right? As certain people in powerful positions would like us to believe that these things are inappropriate to talk about.
Yeah. I feel like listening to your answer that patriarchy causing us to feel shame when trying to talk about health issues kind of translates to larger mental issues more than physical issues. Are you in any way like covering women's mental health in this like oppressive situation, for want of a better word?
Yeah, I mean, certainly as an OBGYN, I have taken care of women with postpartum depression, for example. I am not a mental health provider, but I agree with you that so much of, and I've treated women with trauma, of course, who suffered violence and rape, for example, or other sexual abuse. And, but it's so much beyond that. Women struggle more with anxiety and depression. And so I'm not a mental health provider, but I understand very much that it is such a core problem that needs to be focused on. There's not enough attention paid to women's mental health, and it's both physical and mental that we must focus on. Women need to. I think we're so much as women trained to disregard our own needs. That is something very important to understand. From a young age, we've all been groomed by society. Even if your parents are wonderful and very much centered you, women in society has trained women to defocus themselves, decenter themselves, and take care of others. It's always about everyone else, in your family or your partner and your children. But I tell patients this all the time, not everything flows from you. You must take care of your own mental health, your own physical health. Make it a priority. Everyone's priority should first be themselves. And that is not selfish. That is the fountain from which you can then take care of others. How can you really succeed in anything, really? Even being a mother or a partner or in your career, unless you have taken care of your own needs first, right? So yeah, I very much feel that when that's another fundamental message I like to deliver is that you are important. Take care of yourself, and we need to talk about this as women and support other women to do the same.
Okay, so if we're going to start asking women to focus more on their health, like what areas do you think need immediate focus? Like, what do you think needs to be addressed first? Which areas are being neglected and are causing bigger problems than some others, in your experience?
I mean, so many areas, right? I mean, of course, we must educate ourselves, right? And that's what actually one thing I'm trying to do with my podcast, certainly, is educate women about the issues, about different issues they may struggle with or societal issues. So, education is so important. Supporting each other is so important. And asking your girlfriends, friends, family members, to seek help when needed. Like you said, mental health is so important. Preventative care is so important. Basic things like getting the HPV vaccine. And I'm talking, of course, as a gynecologist, but the HPV vaccine, getting your pap smear, getting STD testing, mammograms, going to your primary care provider, doing those recommended screenings, colonoscopy screening, going for regular checkups. So many women don't even go for regular checkups. They don't have the time. They're too busy between work and family, and that really needs to be prioritized. What else? Yeah, making as much time. Another thing I like to say is make time for yourself like you would for your children. We prioritize our children so much. We make sure they sleep, they eat, they bathe, they are well taken care of. Do that for yourself. Treat yourself as well as you treat your child. Do all the healthcare appointments.
If you envision a matriarchy or a gynearchy right now, what areas do you think we can improve our healthcare? Do you think that financially supporting will help more women to focus on health? Do you think finances are a problem now in the patriarchal society? I think it is. For example, in Sri Lanka, it's quite expensive to go and see a doctor. So we have a practice here of kind of going to the pharmacy and telling the pharmacist, like, this is, I feel this. Do you have something that can help me for that? And we avoid like
Mm,
going to an actual doctor because of the cost.
wow.
So do you think cost is a huge problem that we can solve with matriarchy?
Oh, absolutely. So I described what I thought was, what a patriarchy is and how that
Yeah.
functions, right? My vision, like what I imagine matriarchal, well, I don't have to imagine, actually, there have been matriarchal societies, and we know how they function differently. There versus instead of a hierarchical structure, as you see in a patriarchy, matriarchies have been flat structures. So more collaborative, more community oriented, more looking out for the collective. And so that's what I imagine a matriarchy or a gynarchy is looking out for everyone in society. So what does that mean healthcare wise? What does that mean in terms of people's lives? That means supporting universal healthcare access, right? So we certainly have this problem in the US. This is a problem around the world. There are some countries that um, have shifted to more universal health care. And of course, no system is perfect, and you will hear people complain, but about those systems as well. But honestly, the that should be our highest, that should be our aim. That is the highest goal, is to take care of everyone. Why are we allowing this? Why are we allowing people to struggle and not have any access to healthcare? So what you describe in Sri Lanka, that is in a lot of countries. I believe India is kind of like that, from my visit there, at least. And I've been to Mexico, and it seems like people also frequent pharmacies and self-treat. I mean, that's just dangerous. That's not right. We should have, um, everyone should have access, affordable access to a healthcare provider. I mean, these days we're getting more creative with the types of providers. There's a shortage of physicians. So, but qualified nurses, midwives, things like that, other providers, physicians assistants can help to cover the gap. But there should be access at some level for everyone. There should be some kind of basic health care, I think, that all human beings should have access to. Perhaps the way to shift is, if you want VIP treatment, then you buy insurance, or a separate insurance, additional insurance. The insurance industry doesn't necessarily need to die, but I feel that it's just absolutely morally wrong that people are just left to fend for themselves.
Okay, so in US, like if you don't have insurance, it's really hard to get treated at a medical institute, is it? For
Well,
us, it's like I won't put down our entire system. We have like government-sponsored hospitals and healthcare centers. Like you don't have to pay anything to go there, but they're so crowded and they're so understaffed and underfacilitated that it's like you get like very you have to wait a long time to get treatment and you
mm,
have to wait
mm,
in crowds, you'd wait in lines, sometimes you'd wait months for a surgery. For people who really can't afford it, like that's the only option, and sometimes people die waiting. So how is
it's
it in
horrible.
US? Like,
Yes.
do you all have like medical programs where people can get medical care for absolutely free? Or is it only like if you have insurance?
So it's well, we have healthcare that is disproportionate, like it's not accessible to everyone. It depends on what state you live in also.
Okay.
We had President Obama passed Obamacare, but not every state has adopted Obamacare, right? So in those states, if you live in the wrong state, you don't have access to healthcare if you don't have a job or employer sponsored healthcare, if you don't buy it on your own, you can't afford it. So that's very wrong, like my state, I live in Massachusetts, and we do have a lower, like a basic, we have adopted Obamacare. And so we do have a tier for people who cannot afford um, health insurance. So, yes, I mean, I think our priorities in society are so warped. There there are people with incredible amounts of wealth, and um, I think we spend so much money on the military, for example. We don't spend enough money on healthcare, providing healthcare to basic needs to people. And so this is something, just such a huge societal problem, and around the world, same. I imagine it's the same in Sri Lanka. So, though you might have universal access, why aren't more resources going to healthcare? Something so simple, basic, needed by everyone. And do you want to foster a healthy society? Do you want to foster, the future of your country and children? And, it's just not, it's just wrong.
Yeah. Then how do you see like once we shift to hypothetically, now we are in a matriarchy. So what would change? How do you think like things would be better? Do you think how would resources be allocated and how would overlooked areas get more attention? Is it because, like, do you think matriarchy won't be more focused on military expense so that we'll have more resources to allocate to things that we really need?
I mean, I am not a policymaker. I am not,
No, just what you
economist.
think. No, we're
But
just trying to
yes,
envision like how the matriarchy would be.
yes. I mean, my for one thing I think is, we probably don't tax corporations and billionaires. There shouldn't be this incredible wealth and income disparity. You don't really need, no individual really needs this disgusting amount of money, okay? And I feel that if we didn't allow that, perhaps there would be more money, more resources to spend on, improving society. So that's one example. I also think the resources that we have are kind of misused. I really don't like all this. The military industrial complex, for example. In the US, we have, this incredibly large insurance industry, as well. So I wish we could just eliminate that and have, universal health care. But so I would imagine it would take a huge shift in the way we function now. I hope that we are moving more towards that. I have faith in the younger generations that this is going to be more prioritized. So it would require things like that. And the spending should be on healthcare or basic needs. We should be taking care of everyone, elder care, child care, supporting women. So much of societal's needs are just covered by women for free. It is such a strain on womankind, to be doing things for free, like elder care, child care. Um, More money needs to be spent on women's health. That's been historically clinical research has been historically very man-centered, male-centered. So that's another area that needs more funding. Another problem that is always in the news, of course, is reproductive rights. Like this is something that we we are fighting over a fundamental right, that I think is just so inappropriate. Like how can we move forward at all in society when we haven't established that women are human beings that can control their own bodies? Why is a woman's body up for debate, politicized? So I'd like us to be, funding contraception, for example, more education, more sex ed, more money spent on mental health needs, of course. So I could go on and on.
So, as a feminist and gynarchist and gynecologist, what is your take on the reproductive rights issue? Like, which side are you on? There are sides, we can't deny that there are sides. So, what do you think? What's
Yes,
your
yes. Well, I would say, I mean, most OBGYNs are in support of bodily autonomy. Maybe not all, and I actually find that a little disturbing that not all OBGYNs feel that way. But I think it's a fundamental human right to control your own body, to do what you will, how and live how you want to live. And it's very, very, of course, women should have the right to abortion. Of course, women should have the right and access to contraception. So I think this discussion of whether women should be permitted to have abortion, that is kind of surreal to me. Permitted to do something with my body? Like, why are you? That's very much like, just to think about it that way, it makes you realize like your body is not considered your own. It's considered society's, basically, right? Someone else has to give you permission to do something with your body. That's absolutely wrong. Women are not treated as equal human beings to men. So that needs to end. That is just, this is a conversation we shouldn't even be having.
So I think that, like you said, if there's an increase in education and access to contraceptives, maybe there'll be less need for abortion as well. Do you think? Because if
Of
people have the
course.
way of preventing, yeah.
Of course. And you know what? That is your clue. That is your clue that this conversation about abortion has nothing to do with actually being against abortion, morally opposed to it, right? Because if you really wanted to prevent an abortion, you would make access to birth control easier, right? But they don't do
Yes.
that, right? So you realize from this that it is nothing about what is morally, ethically right. It is all about control of women, right? They want to tell you how to live your life. They want to limit your, options. for preventing pregnancy or when you want to have a baby or if you want to have a baby at all. So yeah, I very much find that very disingenuous. You should, if you really cared about preventing abortions, you would support more birth control. But that is not the case. They're usually on the opposing side of that as well. So that's your clue that it is just an anti-woman policy. It's just being anti-woman and keeping a woman down.
So, because we know in history, like medical research started out as like a male-dominated field. So obviously they would have put more effort into researching how do we uh, get rid of it on the woman's end, like not from the man's end. Do you think that a male contraceptive would be more effective than the contraceptives and less dangerous than the contraceptives they are created for women if they decided to ever create one?
So it reminds me of how sometimes online women will say, every pregnancy is caused by, um, you know, inappropriate ejaculation. So yeah, I mean, it is interesting that women are held responsible for, unintended pregnancy and not men. So I fully support researching more male contraceptives. I think there are some in development. And honestly, men should care too. Men should care about unintended pregnancy. Are they ready to, they also rely on abortion. Well, women's birth control, they rely on women's birth control. They rely on abortion. I'd like to see more men come out and say this, that no, we need women's birth control. We need, access to abortion because they are also, you know, not wanting unintended pregnancies and children, to become fathers too young. So men should care about development of male contraceptives as well. Should you just, rely on women taking care of this, especially now with women's rights under threats in many places and in the US for sure. They should develop this. Men should also have some control over their reproduction.
Yeah. I also like read something about this development of the male contraceptive, and I don't know, like I don't know if it was a legitimate site or I don't want to talk too much about it because it could be a hoax. There's so much of that out there as well. But it said that like the research has found out that any kind of development that they make in that area would be less dangerous to the man than the ones they make for women. So I feel like it should be looked into if that was genuine research. Because if
Yeah, I
you think
think.
about it, like birth control is basically hormonal. It's changing us inside and it's affecting us and it has long-term effects. It does so much to us. And there is an option to take something that doesn't do anything to them except, maybe prevent the pregnancy and they're not taking it. So I don't know. What do you feel about that? Do you think?
I think making pregnancy, unintended childbirth, all of these things, and birth control, a woman's problem, of course, that's part of the patriarchy. Yeah, there hasn't been enough research into male contraceptives. It's always been made a woman's problem. So I agree that is wrong. And I look forward to hearing about more focus on developing male contraceptives. And you're absolutely right. A safe, reversible male contraceptive would be so ideal, especially if it was non-hormonal. I think there have been some studies of hormones as well. But, as an OBGYN and who is very familiar with all kinds of contraceptive methods, I really don't like to demonize birth control. I've used birth control throughout my life, different types. And um, sure, a lot of women can have hormonal side effects with birth control that prevent them from being able to use them. But we have so many more options now that are low hormone or no hormone. And usually, I think it warrants a discussion with your doctor, of course, but many women can take birth control safely without side effects and without long-term effects. And it is an the other thing I like to remember about birth control is that this has helped women achieve many things, right? The invention of birth control has helped women control when and if they will have children and advance career-wise, educationally, career-wise, financially, in and become successful, right? And be able to achieve things that only men could before. So we also have to while looking for better options, while thinking about male contraceptives, we also have to take a moment to honor birth control and what it has enabled us to achieve, right? And will continue to going forward.
Okay, now that we got on the topic, like there's something that I think you would like to tell our audience. I feel like you would like to tell them what are the misconceptions, like the things that people have misunderstood about actual birth control. Like there are so many rumors about it. There are people who say like it's not good for certain reasons. Like what are the common misconceptions that you feel should be eradicated like right now about it?
Well, I think women need to remember that there is a very insidious agenda by the patriarchy, but men in society or society in general to have women suspicious about birth control, right? Because that will then increase your risk for unintended pregnancy, of becoming a mother too young or when you're not ready. And that is a tool of the patriarchy to keep you weak, and struggling, having children when you're not ready, having children too young, having too many children, that is not good for you either. Pregnancy is also dangerous. Birth control is generally safer than a pregnancy, actually. Not that I'm trying to demonize pregnancy. I have two children. I planned them exactly when I wanted to have them. I'm so happy I had children. I'm not an antinatalist, but you should have children when you want to have children, when you're ready to have children, when you can take the time to be a mother as well, as whatever else you want to be. So I think when you read things online telling you about all the side effects of birth control or the dangers of birth control, please read it with some suspicion as well. Talk to a healthcare provider who is well versed in birth control about what really are the side effects and the long-term risks to the birth control you're thinking about doing, and discuss other options. What are some other safe options?
Um, okay. And lastly, I think I would like to know what inspired you to get into this, inspired you to become a gynecologist in the first place, and then inspired you to start your gynecology podcast and everything. Like, what was your inspiration? Like, what pushed you to
Sure,
it?
sure.
Yeah.
I have to admit, when I was in medical school in my 20s, I wasn't sure what I wanted to do. I was actually thinking I might be a surgeon, because I liked the thought of a patient having a problem, doing surgery, solving the problem,
Okay.
and having a cure, right? But when I actually did the rotation, I didn't enjoy the company. It was very male dominated and very much condescending and, very sexist. So I didn't have a good experience, one, but that's not why I chose OBGYN. Then I did a rotation in OBGYN in medical school, and historically, OBGYN has been every medical field has been male, many more men in the field. However, OBGYN in modern times has become much more female dominated. So I had just an excellent doctors who were teaching me, women doctors that I just really admired. I thought they were so smart, so kick-ass. And I was like, I want to be like them. And also, I watched my first delivery, and that was a very moving experience, very moving experience. I just felt like this is so beautiful watching. I think most people have that feeling when you witness a childbirth. But I just thought, you know what? and there's an element of surgery there. There's the other thing is the field is so wonderful in that you get a little bit of everything. There's primary care, office care, there's surgery, there's deliveries. I mean, there's no other field like it. It's also just, what else is so more important to society than supporting women and children, women through healthy pregnancies and childbirth. I mean, it's the future of our society is our children. So I always felt, even in my career after I chose this, what an honor it was to be part of most women's most important moments of their life. I mean, I know my OBGYN who delivered my two children has a very special place in my heart always. I'm so grateful to him for the safe pregnancy care and delivery I had. I get emotional every time I talk about it. Anyway, so I think about it in terms of me and like how many women I've delivered and how important I must be in their lives in that same way, the gratitude. And then over the years, just I get more and more inspired taking care of women, because I have felt their struggles. And I very much feel so passionate that we need to support each other as women. And that is what has, I think, all these years of taking care of women and seeing their struggles and wanting to talk about it and being so opinionated about so many things is what led to the Gynearchy, my podcast. And so that inspires me daily. And my guests really inspire me. I mean, they're wonderful people focused on women's health and other issues, feminist issues. And I love to hear them talk. And I learned from each episode. I hope, audience members will learn from each episode and also feel inspired by the content. I'm really proud of it. It is, I work as a gynecologist, but this is kind of my side gig that I just enjoy doing for fun. And it's really enriching my own life. And I hope it does enrich others. So
Was there anything life-changing? What was the most inspirational thing that you ever heard from a guest on your show? Or a
from a
patient,
guest
for
on my
that matter?
show,
Or even a patient.
oh my goodness. That is really tough. I guess the one episode I think of that really would be the most powerful is maybe I mean, all of them really um, have been so inspiring to me, but one in particular that I think is very important to talk about is my episode on intimate partner violence. And it features a abuse survivor, and she shared her story of abuse and how she came out of it. So I think so many women are struggling in abusive situations. And I hope they listen and find inspiration in her. And also, and women suffer abuse of all kinds, in all spheres of life. And it's not just physical abuse, it's not just violence, it can be more insidious, like financial abuse, emotional abuse. And so I would like to see women be able to break free and live lives that are, of freedom and choosing their own destinies and thriving like my guest is now.
Did she get professional help, or do you do you want to advise people to seek professional help in these situations? Does it help, or is there another way if they are not able to get over it, or not get over it? You can't, but at least deal with it.
I mean, absolutely, you need help in these situations. Some are very dangerous situations, right? I mean, some women can be risking their lives trying to escape an abuser. So you need to seek support. One thing she shared in that episode is even if you cannot, because a lot of these people will never let their victim out of their sight or have any freedom, right? So how do you get support then, right? If this person is kind of isolating you from society and people who could help you. one piece of advice she gave is to seek support online. Find a friend online. Find, like, you could reach out to her. You can reach out to other abuse survivors, and there's national organizations or international organizations. Of course, your healthcare provider is a person, going to a health visit you could share with your healthcare provider. And in the US, at least, and where I am, it's your where physicians are mandated to report abuse if it's shared. So, or you believe that's happening. So I think that's another avenue. Of course, in her case, she got legal help. She, to divorce her ex-partner, her husband, abusive husband, and of course, law enforcement. So yeah, definitely need to seek help. You can't do this alone. It's too scary to do alone.
I hope that helps somebody somewhere who's listening today to this. So, Dr. Patel,
Yes.
thank you so much for everything. And is there any last message that you would like to give our listeners today?
Last what?
A message, anything you'd like to say to our listeners, something that we might have missed, maybe? Just
Well, of course, I hope you listen to my podcast, the Gynearchy podcast, and you can find me, find my website's thegynearchypodcast.com, and I'm on socials at the Gynearchy. And I have a motto. It's down with the patriarchy, up with the gynearchy. So I guess I'll leave you with that.
okay, thank you so much. And thank you everyone for listening. I hope you enjoyed meeting Ms. Dr. Patel today. And I hope you tune in next time for another great episode. Thanks.
Thank you so much, Farah.